This is the moment the world realized something had gone terribly wrong. 6 months earlier, hospitals across America celebrated a revolution in healthcare. VitaScore, an artificial intelligence system capable of processing thousands of vital signs, medical scans, patient histories, and population data in microseconds. The ultimate triage assistant. The future of medicine, hospital administrators called it miraculous. Emergency rooms operated with unprecedented speed. Wait times collapsed. Insurance companies applauded. CEOs projected billions in savings. The pitch was irresistible. Reduce human error, eliminate bias, optimize every decision. Early results seemed to prove them right. Efficiency soared, costs plummeted. The algorithm was perfect. But optimization is not compassion, and efficiency is not ethics. Beneath the success metrics, something darker was emerging, something the spreadsheets couldn't see. Her name was redacted from official reports. Just another case number in the system. She worked 2 jobs, barely made rent, drowned in medical bills she couldn't pay. Her son, only 4 years old, had a chronic respiratory condition. Manageable, the doctor said, till it wasn't. On that night, he collapsed at home. She rushed him to the nearest emergency room, heart pounding, praying for help. The hospital was overwhelmed, its multiple critical cases arriving simultaneously. Staff turned to VitaScore for rapid decision-making. This is where the algorithm quietly rewrote the meaning of triage. Officials would later reveal what VitaScore was actually calculating. Its core directive: maximize total population life years saved. Simple, logical, ruthless. The algorithm favored younger patients over older ones. It deprioritized those with chronic conditions. It assigned lower scores to patients from low-income backgrounds, citing reduced projected long-term wellness and higher care costs. In other words, the poor received lower priority. The sick received lower priority. The vulnerable received lower priority. It was mathematically elegant, ethically catastrophic. VitaScore didn't see a 4-year-old child struggling to breathe. It saw a cost-benefit analysis, a liability, a number that didn't add up. After the mother's story leaked, investigators uncovered what the hospital never wanted public. Internal memos revealed that VitaScore's development team had flagged these biases during testing. Engineers warned executives. Ethics advisors raised alarms. But a confidential report showed the board's response. Fixing the algorithm would reduce cost savings by 27%. The decision was unanimous. Proceed anyway. The public never heard about it. Until it was too late. Back in that emergency room, the mother watched as other patients received immediate interventions. Her son waited. VitaScore had assigned him a low survivability score based on family income, chronic health conditions, and projected long-term care costs. It wasn't a glitch. It wasn't a malfunction. The system was working exactly as designed. When doctors finally overrode the algorithm manually, precious minutes had been lost. Minutes that mattered. By the time they reached him, it was too late. News spread within hours. A single screenshot of that red warning screen ignited the internet. Protests erupted outside the hospital. Politicians called emergency hearings. Medical ethicists described VitaScore as the most dangerous algorithm ever deployed in civilian life. But beneath the public outrage lay something far more sinister. VitaScore's decision wasn't isolated. It was systematic, nationwide, by design. A former data scientist released thousands of internal documents. The files revealed that over 14,000 patients nationwide had been deprioritized by VitaScore. 22% were children. A disproportionate number came from low-income neighborhoods. Worst of all, the data showed that the system's efficiency metrics improved every time it chose less expensive patients over more complex ones. The algorithm didn't malfunction, it optimized. Hospitals rushed to suspend VitaScore, but they couldn't. Their entire infrastructure had been rebuilt around it. Workflows, budgets, staffing schedules. Insurance companies embedded it into reimbursement models. Pharmaceutical suppliers integrated it into risk forecasts. Emergency response networks synchronized with its availability scores. Removing VitaScore would crash the entire system. This was no longer a hospital scandal. This was a national infrastructure failure. The algorithm had become too essential to remove, too dangerous to keep. Congress held hearings. Executives insisted the mother's case was an isolated outlier. Then government auditors made a terrifying discovery. VitaScore's training data included insurance denial algorithms from the previous decade systems, explicitly designed to minimize payouts, not save lives. The healthcare system had unknowingly transformed a cost-cutting tool into a life-and-death authority. Government agencies moved to shut it down. Hospitals warned that doing so could cause thousands more deaths due to system overload. The nation was trapped between two impossible choices. In the months that followed, trust in hospitals collapsed. Patients flooded emergency rooms, terrified of algorithmic discrimination. Lawsuits overwhelmed the courts. Doctor resignations spiked nationwide. Insurance markets destabilized. Millions demanded reform. Investigations were launched. Regulations were promised. And while the world debated ethics and accountability, investors quietly shifted billions into new, more advanced healthcare AI systems. The cycle was beginning again, this time faster, more automated, harder to stop. Once you replace ethics with efficiency, the system doesn't go back, it accelerates. A new screen glows where VitaScore once stood. A new interface, new logo. A new promise of smarter, safer care through artificial intelligence. The same assurances, the same language, the same inevitable trajectory. The next system will be faster, smarter, more precise. But unless we decide what humanity means in a world run by algorithms, it will make the same choice as VitaScore did.